Drug treatment has long been a challenge for many drug users in BC. The BC Conservative Party says it will use involuntary treatment to care for people suffering from severe addictions if it wins the fall provincial election. More than 4 decades ago, though, involuntary care was already being discussed in provincial politics when a heroin treatment centre opened on Vancouver Island. Then BC Health Minister Bob McClelland criticized the federal government for refusing to help BC deal with what he called a national problem.
It is Canada's problem, and British Columbia will stand by no longer and allow it to continue to spread through our society while others say to us that it is a problem that either has no solution or is too difficult to solve.
The new Brannan Lake Detention Centre will handle the hardcore of British Columbia's estimated 8,000 heroin users. They'll be sent here for up to 6 months treatment that begins with withdrawal from heroin use, eased by the administration of methadone. The program's being phased in with addicts invited to turn themselves in, but only a handful have so far come forward.
What do you think of the chances of your kicking the habit here?
I think it's really good because I want to kick, but I don't know about the compulsory treatment yet. Most people I know don't want to kick.
Very soon, anyone held to be a drug user will be sent to Brannan Lake or ordered to take treatment at an outpatient clinic. Extended psychiatric counseling and teaching of job skills will try and equip addicts with a new lifestyle, free from drugs. The program looks for a 70% success rate. The legal profession remains nervous. The Medical Association has agreed to cooperate, but doctors specializing in drug problems still say experience in other countries suggests results will never justify the means used here.
You cannot see in our system withdrawal of rights, particularly if you cannot guarantee, and by guarantee I mean 80% or better results. And this is an experimental program. It's not a guaranteed program even at this point.
There's one further barrier to the full-scale roundup of drug addicts, which is due to begin on July the 1st, a challenge in the courts, which the Civil Liberties Association will launch later this month. Colin Holt, CBC News at Brannan Lake on Vancouver Island.
Joining us for more is Tyson Singh Kelsall, a PhD candidate in SFU's Faculty of Health Sciences and a downtown east side-based outreach worker. Tyson, we appreciate you being here. How much does involuntary opioid addiction care work?
It doesn't work, really. Currently, we only have forced treatment under the Mental Health Act. It's not meant to be used as a tool for apprehending and forcing people who use drugs into treatment, although it is used in that way sometimes. And from the research that has been done in the city, there is no significant statistical difference in use patterns amongst people who attend and who do not.
Just to give us a sense of how deep does that research go? How recent and how many people did it involve, do you know?
I'm not sure the exact number of people that were involved in the research, but it was, linked to hospital data. It was based on people's experiences going into forced treatment. But what we do have a better idea of in BC is experiences under the Mental Health Act, which is the tool that's used most to apprehend people and force them into treatment, force them into psych wards. And we know that people's experiences are not good. And we know from a recent ombudsperson report that the Mental Health Act, its use is not often within what it says on paper. It's often weaponized against people, and people's rights-based paperwork are not filled out. And I think that is very similar to, the clip you just played ended with the line around rounding up drug users. In the BC or the Civil Liberties Association wanting to challenge that, and David Eby, the former head of the BCCLA, now having a very different tune than being in support of people's civil liberties in this situation.
And certainly he's sitting in a different chair as the premier, and I respect that point. We did hear from somebody in that story from 1979 who did go, but said, I don't know about the compulsory component. To that end, though, what responsibility do healthcare providers and others have to people who would not voluntarily get treatment and are a danger to themselves and perhaps others?
Yeah, Dan, thanks for the question. I think that's really valuable. And I think before we even start talking about involuntary treatment or forced care that is not effective and does not help people and is an extremely traumatic experience, which actually drives people away from the healthcare system, we need to ask, if we're starting something new, if we're doing a new policy, if we're building new facilities, why don't we start with something that people actually want, that we actually want, that we benefit from? There are no facilities for involuntary care. Our psych wards are full. People are being sent to them under the Mental Health Act and being discharged in less than a day. And so these policies that are being suggested by both John Rustad and David Eby, I think, are really distractions, from the healthcare crises that are occurring in our province.
If I can, then what would you suggest as an alternative? What would you like to see outside of involuntary care that will have people who are living with an opioid or a drug addiction say, I want to go there, I want to get into that program?
Yeah, I mean, for starters, the drug supply has never been more contaminated. Fentanyl overtook the heroin supply in the street almost a decade ago, and now we're seeing benzos and sedatives in the drug supply. And, benzos are one of the most difficult drugs to stop using. We need a regulated drug supply because quitting, a fentanyl habit and a benzo one is next to impossible. And it's also made recovery and treatment-based programs extremely, much more dangerous than they used to be, because discharge and lower tolerance come with so many risk factors. So we need to start by regulating the drug supply and making treatment safer. I'm just one of many, many people calling for basic human rights to be met in this province. We have an 18,000 person BC housing waitlist just in Metro Vancouver. The welfare rate is as low as $600 for some people still, the cost of rent has fast eclipsed that. And the drug supply, again, is extremely toxic. So we need to start with interventions that people would actually benefit from before we even entertain this conversation of handcuffing people and forcibly injecting them.
Tyson Singh Kelsall, PhD candidate at SFU. We appreciate your time and your perspective. Thanks very much.
Thanks, Dan.